Today I will be talking about nursing facility closures in South Dakota. Closing nursing homes and assisted livings in South Dakota decreases the amount of care available to those in need. With fewer places to go, they must be further away from families and may not receive the care that they may need. 15% of nursing facilities in South Dakota, or 10% of facilities, have closed in the last 5 years, 7 of which closed alone in 2023. Families are forced to find at-home health care or move their loved ones to facilities that are far away, which makes it hard to transport to see them enough to be a support system for them or even care for them. Staffing, pay, and Medicaid reimbursement have played a huge role in facilities shutting down across the state. Closing nursing homes and assisted livings in South Dakota decreases the amount of care available to those in need. With fewer places to go, they have to be further away from families and may not receive the full care they may need, or staff may not be treating them the correct way the family may want them to. It's really hard when understaffed and residents are not receiving the support that they may need to have or live a happy and quality of life. Many of them have closed in the last 5 years, and which this causes family members to not see them as much as they should, and it causes the residents to lose their support systems. Residents may not receive the adequate care or quality of care they need to, especially if family cannot check in on staff or how they may be treating them. Facilities closing in the state leads to less rooms available to those in need and cause a lack of appropriate care for these residents. Family at times may take care of their loved ones at home because they do not have room available anywhere else, or they want their families to have the appropriate level of care that they feel they may need. And a lot of families feel that they're not receiving a happy quality of life within nursing facilities, which it is very true because staff are oftentimes not given enough time to give residents the kind of attention that they should. Many turn to home health to try to keep them as much as possible, as long as possible. This also contributes to home or nursing home funds because if they're not having those residents to fill their beds, they're forced to close down wings, close down rooms, not get the funds that they may need, not have enough referrals to fill their beds. There are many causes to needing shut down facility, and they have no one to turn for help in these situations. The staffing crisis and underfunding for Medicaid have detrimental effect on nursing facilities. When facilities become understaffed, they often turn to travel agencies or lose their full-time staff to the conditions. Travel agencies often cost twice as much as normal staff, so that causes the facility to lose funds very quickly, or not have enough to give their staff the right amount of raises each year, so it causes them to leave the medical field in a total. The crisis has led to high stress, short staffing, travel agencies depleting the funds, staff leaving not only the facility but medical fields in total, and the conditions of the working environment have led to them wanting to leave as quickly as possible. They often turn to travel agencies too because the pay is twice as much, so who wouldn't want to be paid as much to do the same amount of work? Or at times travel agencies don't do as much work as the regular staff. Nursing homes estimate to lose about $35 for every Medicaid resident. Residents who are placed in Medicaid programs are often private pay or have a different way to pay until their funds are completely depleted, and then they're placed on Medicaid because they have no other way to pay. And the Medicaid reimbursement is only 21% increased, so it's about 90%, so it leaves the facility to cover 10% of the costs, which costs them an average of $35 a day. You times that by, usually there's 40 residents in a facility, so 40 times 10, maybe $400 a day loss, which is quite hefty. 55% of long-term care residents rely on Medicaid for the care, so 20 out of 40 residents, that's still $200 a day. The legislature approved this act it's still causing an increase in nursing homes closing because there's still 10% of coverage that they're expected to pay. The closing of nursing facilities in the future causes an effect on generations in the future because these facilities are often closed permanently. They have to be up to standard, up to code with their electrics, their plumbing, their even their paint, like the look of the building, the physical aspect of it, the staffing ratios. They're often not really open. I worked in Armour. That was a facility. In 2022 we closed, and they told us if we were to close, we would never open back up because it would cost too much to upgrade the boiler, the electricity, the plumbing, everything that it would take to be up to state standards and codes. So if they also have to have proper equipment and means to function in the correct way. So this takes a lot of money to get back up to code. So that takes another way of facilities being able to stay open or even reopen if they need to. There's not many new facilities opening in South Dakota. There has been one in the last 3 years, and that is in Flandreau. I currently work at that facility too. They opened the beginning of 2023, and that is one of the only facilities that has opened. Out of the 10% of facilities that has closed in the last 5 years, there's only one facility that is open in that 5 years. Some facilities close to environmental reasons too, such as I said, they have to be up to code. But in Wagner, there was the Good Samaritan building burned down or their kitchen area. Not the whole building, but the kitchen area burned down, and they had to evacuate all the residents and disperse them into facilities close within that area. So Lake Andes, where I currently work, took in quite a few, about 5 residents. So that also put a lot of stress onto our staff because we didn't have enough staff at that time to take care of that many residents. But they plan to reopen Wagner in 2025, so that'll be another facility that would be considered opening within this 5 years. They did get the building back up to code to fix the boilers, fix the electricity, redo the entire roof where the fire did take place, and they got it back up to code, so they are able to reopen, which not many facilities are able to be that lucky. And the effects of these closures are on the staff, on the families, and on the residents. It's a decrease of mental health for the residents. They don't have a support system. It often there's like residents who get PTSD and traumatic effects of this because I had a facility closed down due to a tornado. They moved to us. They had no issues with behaviors, and the tornado had caused a snap in them to have almost panic attacks because I don't know if it caused flashbacks of something happening in their life, or the doctors could not figure out what exactly was causing these, so they just kind of blamed it on the tornado of like a post-traumatic stress disorder. There's a decrease in health workers. Once they're done in these facilities, they often quit healthcare completely. Only about 5 workers at the facility I worked at in Armour went on to work in healthcare. Many of them don't even work in healthcare anymore because it was almost too stressful of the closure and sad to go through all that. There's a decrease in availability for facilities for families. They have to go further away. There's a loss in tax revenue for the city, for the state, for the county from the facility that they provide. There's an increase in stress in hospitals because these residents are often having to stay longer periods of time at the hospital and often may die there, or they may need to be there for way too long, and the hospitals are not staffed or enough supplies to take care of these residents that way. They also do not get as much money per these people unless they're on Medicaid A or private pay. Having the facilities permanently closed leaves a lasting impact on everyone. It's a lot of mental health on the staff, especially because, like I could say, it was a very sad time in my life when it closed. I had been there for 2 years, and it was hard to see the residents go, hard to see them have to go through that, losing their home, losing their family, because staff become family at that point. Sometimes family aren't able to see them, so it becomes a kind of family environment in those kind of places. Travel agencies have increased in popularity since the COVID-19 pandemic. They often pay their employees over double that of the facility employee. So this causes more of a staffing crisis to lose employees to travel agencies, or have staff quit because they feel they're not being paid enough or the same or equal amount for doing more work than the travel agency workers. It's a very mentally exhausting job working in healthcare, especially in nursing homes. It doesn't reflect what we do on a day-to-day basis. It doesn't seem seem worth it to have the career in healthcare because of the stress and mental health things you go through. You feel like you're not paid enough. You're not recognized enough for the work that you are putting in. So, in conclusion, um, um, the workers are what keep the facility functioning. The residents are what keep the facility functioning. The pay is not where it needs to be able to continue running facility closures. And at this rate, many more facilities will be closing. South Dakota needs to put further programs in place to reduce facilities shutting down or needing to close wings or portions of it. Healthcare workers do not need to turn to travel agencies to feel they're being paid what they should not need to feel like they are, to feel like they're being paid what they deserve. They should be acknowledged by their companies of the amount of work that they are putting in. Medicare reimbursement plays a huge role in facilities' monthly costs, so South Dakota needs to work harder. Not only South Dakota, but many facilities across the United States need to play a huge role in trying to help this issue as much as they can, because I feel like they are not stressing the issue as much as they can. A decrease in healthcare facilities means a decrease in care for your loved ones, and not only availability of facilities, but facilities not providing the correct care and quality of care that your loved ones may need. It's causing healthcare workers to leave the industry completely, or facilities in general, and it's a very sad situation that needs to have some better roles.